So this is where the good hygiene works. Yes, in systemic diseases, you have some infection in the stomach, you have some infection in the esophagus, gastroesophageal reflux, and it stays inside your mouth. Kidney especially, uremia. If your urea is high, the smell, you can get the smell through the mouth.
Right.
Diabetes and sakar and people go into a stage of diabetic ketoacidosis. Okay, that acid is thrown out from your blood, from your mouth into the air. And many times we have seen, as the patient walks in, I know this patient is already into diabetic ketoacidosis. So these are a few things that if you have, and infections, leukemia patient, okay, CKD patient, kidney failure patient. These are all the patients you can actually recognize them on the face. So in these people, yes, you need to treat the systemic disease. But most of us, we just need to take care of our mouth. Just need to take care of the freshness of the mouth. Just need to take care that the mouth does not have pathogenic bacteria. Bacteria, fungi, these are a lot of things which happen, which go through the mouth into our body. So this is the way I think we have to, a good oral hygiene is a good indicator of a real healthy body.
Right. So I think, what advice would you give to the person who has asked this question, because he is saying like he is taking care of all the oral things. Maybe they are inadequate and he is not on the right path.
Absolutely. I would ask him gently to take care of his face, of his teeth after breakfast, after lunch, after dinner. I would ask him to use floss twice a day, morning and at night. He must use floss. Even if he finds some bleeding is coming out of his body, no problem. Okay, and he must use good water to gargle his mouth.
Right.
These are the 3 or 4 things I will tell him. Besides this, and clean his tongue well.
Right.
Besides this, if he still continues, then yes, and then he must visit a dentist to see if whatever diseases he has in the mouth, and then if not, he must see his own family doctor and ask him, doctor, do I have any systemic disease?
Right. I think we have almost covered up the possibilities of halitosis, and I think we have mostly answered the query of the young man who had asked us about this. And so now is the time to get back to our discussion, which was very important and very interesting, because last time we discussed about what questions we should ask ourselves, to resist stress or to keep stress away. But as we all know that we cannot have a stress-free life, but yet to attain the maximum freedom from stress, there are certain things that you have defined. You have also mentioned about something called as positive stress or eustress and de-stress. Can you put light on these 2 words, because I think we need to turn our stress into eustress.
Yeah. See, normally we all need stress. You cannot work without stress. Okay, there has to be, in everything there's even the muscle, it has a stretch. Even God has given it a stress. If that stretch is gone, the muscle is paralyzed. It will not work. So the stress is necessary for all of us. Like you had to go to office early in the morning and do a particular thing. If that is not there, and you know how much stressful it is, you call it, yes, stress, it is a stress, but you enjoy going there and you enjoy that stress. So stress is our body's reaction to what happens along us. So you have something happens, like somebody in our family dies, somebody in the family gets married, somebody in the family has a fight. All these are physical things which will create stress situation. That means
external causes.
This is a stressor putting a weight stimulus on our body. And how we react to that stimulus is what matters. Okay, so this is a stressor, and what we give out, the response of ours, the physical response, the psychological response, as well as physiological response. In basic reaction, it is called as a flight or fright reaction. Okay, you have a suddenly something happens, either you have to fight or you have to run away. This is a basic reaction of a human, of any living being. Okay, and that is a stress, that is a response. Okay, now this response, how do we respond to us, matters. I can fight or I can fry. I can just flight, I can go away. So I can at that time a lot of adrenaline and cortisol gets suddenly secreted in the body when we respond to it. Now how we create this response and how that level of adrenaline or cortisol is adjusted physiologically in the body matters. If we create, I need to do this like a cricketer, we talked about cricketer last night's fantastic match. Last over, 7 runs to win, and they lose 3 wickets, and just I think 7 or 9 runs to win. Why? Because then there is a tremendous stress on them.
Pressure.
The tremendous stress on the bowler. The bowler bowls the best, most intelligently during that time. He hits a ball, he catches the ball, in a second he turns, hits the wicket without missing it. So this bowler, same stress, this bowler converted that stress into a positive action. This is eustress. While this the batsman, what happened? He just pushed the ball without seeing where is the ball, just ran away, and he got him run out.
Yeah, so that is distress.
This is distress.
Okay.
So it's all of us need to have stress. Till the time that stress is what you like, what you can face, what you can enjoy, that is eustress. Okay. When it is either too much or too less also. Suppose you have nothing to do, okay, what to do? You will be more stressful.
In fact, we can be lousy.
Absolutely.
So we don't want to work.
Even if there is no stress on your body, that is distress, which makes you work negatively, which makes you work as if you are totally different. Okay, these are the two things. Any stress you can convert into eustress by asking those 7 questions to yourself.
Right.
So let's have the stress. Yes, I want to play, so I will have stress, isn't it? Yes.
So this is very good note that we got from you, because most of the time we get bogged down. We get bogged down by the stress, and the stress gets converted into distress. So it is up to us how we convert our stress into eustress, and can get a positive outcome. And for all this, I think for the remedy or the prevention that you have given for all this was what we had discussed in the last episode about the questions that we can ask ourselves. I think we are going in good steps towards de-stressing our life. Like, I had never, this eustress word had never occurred to me. And when we talk about stress and when we think about stress, we always think about how it can have have a negative effect on us. We never give it a thought that it can also have a positive effect, and that stress is also necessary. So this is a very important and interesting thing that we have learned from Dr. Naik today on how to convert the stress into a positive positive stress. Okay. And this is like, you have given several ways on how to lead a stress-free life. And I think you have mentioned about mindful awareness. Can we know about this particular point that you have? What exactly do you mean by mindful awareness?
I say something to you, okay, good or bad, and expect a reaction from it. There is going to be a reaction from you. Okay. So this is what I am putting at you. I am targeting I am giving you a stimulus, and to which you are going to respond.
Right.
In between this stimulus and response, there is a space, there is a time where you decide how to react.
Right.
Should I be happy about this comment? Should I be aggressive about this comment? Should I get angry about this comment? Should I say I am insulted by this comment? Should I say I am delighted by this comment? or should I lie somewhere in between? Lies your whole life and the decisions of life and the progress and the development of life. That space is there. Many times we do not create that space. We react so fast without understanding. If you react fast, that is supposed to be a primary response. When you react slowly, these are various different responses.
So the longer we take to respond gives us time to think on how to respond.
Absolutely. You must become aware of what stimulus I have put on you. You must become aware of how you are going to respond to that stimulus. Keep this responsiveness in your mind, mindful awareness. You are totally aware. I've said something bad to you, but you are totally aware that you can't afford to hurt me.
Right.
Okay? You're totally aware about all this. So then you take it and respond differently. You've seen this happening many times in your life.
Yes. I think when we are abrupt, mostly we give the wrong response.
Absolutely.
Right? So it is like an instant reaction towards the stimulus.
That's a primary reaction.
Right. And
we don't want a primary reaction. We want an intelligent reaction. And that takes time.
That takes time, which is so important, because most of the decisions that we take in life responsively are mostly abrupt, and that is where we go wrong. I think this is a very important reminder that you have given us today, because most of the people, like, we are so much in a hurry. We mostly answer without thinking, and just to win an argument. But if we think and then respond, I think most of the problems may not arise.
You said you want to win an argument. Here you will also win a man, you will win a person, you will win a situation.
We may not get into an argument in the first place.
You will win it also. You will win it also. All that we got to do is, all of us are good, I said, it's are nice, pure souls. All of us are good people. Finally what we are seeking is peace of mind. Absolutely. Because if we are peaceful, then I think we can be alive till 100. Yeah, it has to be. So this is the note that we can bid goodbye on, which we have got from Dr. Naik, to be positive, to be stress-free, or maybe to convert our stress into eustress, and finally lead a very happy, peaceful and active life till 100. So now is again the time to say goodbye to you. Keep watching Alert, Active and Alive at 100. Be with us next Friday on Prudent Media. Till then, goodbye, good luck and namaskar.